time. So a new wave of junior doctor strikes is approaching next week. Health Boss is warning now it's likely to hit the NHS very hard.
A major concern is the uncertainty over critical shifts being filled and the impact of the stoppage after the Easter bank holiday weekend. Matthew Hill reports.
As a junior doctor, Andrew Hibbert makes up a vital part of the team at Southmead's Accident and Emergency Department. In fact, he and his colleagues make up around half the workforce of doctors in the NHS. The last three-day strike resulted in 175,000 appointments and procedures being cancelled. Next Tuesday's strike happens after the long Easter bank holiday weekend when the NHS always struggles to catch up. So the four-day walkout of junior doctors working in both planned and emergency care will in effect mean the NHS is on skeleton staff for over a week. And then, of course, in May, there are the record 3 bank holidays, including the coronation. And when you add the extra demand for tourism, that's a perfect storm for the doctor in charge of the NHS in the region.
Well, we're really worried, as we always are when we approach Easter, that it's going to be busy. But with the combination of the junior doctor industrial action following immediately afterwards, we need the public to help and work with us as they did in the pandemic.
And are you concerned about patient safety?
The efforts that have been taken already to make services safe, we hope are going to be enough, but it is going to be a real challenge. And again, with the public, if they use services wisely and only come to hospital when they need to, we think that we will get through this challenge as we have the others.
Junior doctors are calling for a 35% pay rise to address inflation. The government have said this is unreasonable. With a longer stoppage this time around, it's not just hospitals that will be affected. Many junior doctors do their training as GPs. This practice in Taunton will lose 4 doctors to the strike.
If you are out of area and you're coming to Somerset on holiday and you get a healthcare problem, it's definitely worth still contacting your own surgery. For example, lots of people forget to bring medication. That can easily be issued by your own surgery, or a pharmacy can contact your previous surgery to have that sent through. There's no need to go and have an emergency presentation to local healthcare.
The NHS still want people to use 999 for life-threatening emergencies, but otherwise they're asking patients who are uncertain to use 111 and community pharmacists. Matthew Hill, BBC News.
Lots to get through then. We're joined now by Dr. Mike Greenhalgh. She's the BMA junior, who's on the BMA, Junior Doctors Committee. He's the co-deputy chair and a junior doctor himself in Lancashire. Good to see you this morning.
Good morning.
Lots and lots of people, particularly in the public sector, are looking at their salaries and thinking these are half the rate of inflation. We want a pay rise. Not everyone can have one.
So, absolutely. As you rightly say, lots of people in the public sector have been suffering real terms pay cuts, and junior doctors are amongst some of the highest. Since 2008, junior doctors have seen a real terms pay cut of over 26.1%. Now, that has led to a real recruitment and retention crisis. We're seeing junior doctors leaving the NHS, leaving the profession entirely, or going abroad to work in other countries. We need to make sure that we're sorting out junior doctors' pay, getting a fair deal to try and keep our doctors in the NHS to help get waiting lists down.
Common sense and expert opinion, and I'm looking at... for example, Dr. Sarah Hannah, who works at Guy's and St Thomas's Hospital, senior management team there, says it's impossible to say there won't be harm to patients. Junior doctors are an incredibly important part of the workforce. Now, she's saying what appear to be two very obvious things. Junior doctors are hugely important, and it is inconceivable that you could be on strike for 4 days and there's not harm done.
So I would agree that junior doctors are hugely important and do really valuable work in our NHS. However, I don't agree that patient safety will be impacted. And I can say that because we've just had a series of strikes a month ago where we walked out for 3 days. During that time, we met with the NHS employers 4 times a day. There was a mechanism for them to say if they felt that patient safety was being compromised, and we didn't have a single request for any derogations during that time. Patient safety was maintained in the last strikes, and it will be in these strikes.
Well, you can calibrate harm or safety in different ways, can't you? Harm to patients would also mean that people are not being seen who should be seen. that's harm to patients too. And you cannot not be there and see patients. So there will be people who are not getting to see doctors who otherwise would.
So the important thing to say is
Well, is that necessarily true?
So there's two sides to most doctors' work. There's the emergency side of things, which will be covered by consultants, other senior doctors in the hospital who aren't junior doctors. Now, it's very important for anyone at home, if you do need to come to hospital with an emergency, that whilst the strikes are on, they will still be able to be seen. And as I mentioned, patient safety will be maintained. But as you rightly say, the other side of junior doctors' work it tends to be more on the planned or what we call elective side of things. And unfortunately, there will potentially be disruption there.
And you're also at the same time pulling those senior consultants away from their important work. There will be people at home watching and thinking, I sympathise with junior doctors. However, I've been waiting to see this consultant for 3 months, 4 months, and that's being pushed back again because that consultant is filling your shoes.
So firstly, I'd like to apologise to anyone at home who has had an operation or an appointment cancelled next week due to the industrial action. In my own work in trauma and orthopaedics, we see far too often people who've been waiting very long times to come in and see us in the hospital, waiting very long times for operations. At the moment, we have over 7 million people on waiting lists, and the way we get that down is making sure the NHS is properly funded and staffed, and part of that is making sure that there's a fair deal on pay for our members.
What we know, and indeed from other negotiations that are going on, that the only way to resolve things is by talking.
Absolutely.
So explain to people what is happening in relation to any discussions between you and the government.
So after our last round of industrial action, Mr. Steve Barclay met us for a short meeting, but in that time refused to give any sort of offer whatsoever. We've been clear since then that we're happy to meet at any time. We would still meet him over the bank holiday weekend before the industrial action next week. And if he was to bring a credible offer to us, it could still, even at this late stage of action.
But
So when you say...
he wants you to drop the top rate 35% pay rise going into the talks. Is that the precondition that you're saying he's put on this?
So the first thing to say is that isn't a pay rise. That is the amount that it would take to restore our pay and reverse our pay cuts, to restore our pay. Now, the reason that it's such a large number is because the cuts has been so large. But in reality, what we're talking about here is a first-year doctor going from being paid £14 an hour to £19 an hour.
And on the preconditions?
So it's not a precondition. This is our opening position for negotiations, and we need a position back from the government. It's hard to negotiate when only one side is doing it, and we're not getting anything back from the government on that front. As I said, a credible offer from the government could lead to starting discussions. I absolutely agree with what you said. This is only going to be solved in the room and by talking, and now we need an offer from Mr. Barclay.
Nobody is getting a pay increase in real terms, though, at the moment, are they? And the government told us this. The demand for a 35% pay rise is unreasonable. It would result in some junior doctors receiving a pay rise of well over £20,000. When you look at nurses, for example, and other medical staff who've settled at 5% for the year, as well as the one-off payment from last year, will you meet them at a lower point? And people will be asking, why not, if nurses have?
So the thing, just to reiterate, if the ask is that big, it's only because the pay cut has been that big. All we're asking for is to return to net zero 2008. We're not asking for a pay rise. So if the numbers are that big, it's because the pay cut has been that big. You mentioned nurses and other colleagues who have also been taking industrial action. I think it's worth noting that the teachers' union this week have been given an offer in that similar range, and their members have resoundingly voted to reject it. So what you've got to ask yourself is our position unrealistic with our ask being too high, or is the government being unrealistic by offering far too low to people who are really struggling?
We'll wait to see what happens. The strike starts on Tuesday, is that correct?
That's correct, yes.
Yeah, immediately after the bank holiday. Dr. Mike Greenhalgh, thank you very much, who's from the BMA.
Thank you very much.
Thank you.